afternoon, everyone. You are very welcome to the Prevention and Early Diagnosis of Cancer webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host for today, Cliona Kerwin, Health Promotion and Improvement Officer. Thank you.
Hi, everybody. My name is Cliona Kerwin, Senior Health Promotion and Improvement Officer in Dublin North City and County. I'm absolutely delighted to welcome you to our 5th webinar of our October Staff Health and Wellbeing series. I'm absolutely delighted to have Dr. Una Kennedy talk to us today. Dr. Kennedy is a GP in Phibsborough, and she also works with the National Cancer Control Programme, which includes cancer prevention and early diagnosis, as well as other areas of cancer care. If you would like to ask Dr. Kennedy a question throughout the webinar, if you would please pop that in the chat function. If you're tweeting about today's webinar, please use our hashtag, which is #StaffHealthDNCC. Dr. Kennedy is now going to give us an overview of cancer statistics in Ireland, how to reduce your risk, and the importance of early diagnosis. So I'll hand it over to you, Una. Thank you.
Thanks very much, Cliona. It's great to be here. I'm really delighted to be here. I'll just see if I can figure out how to share my slides now. So here goes. Great. Can everybody see that? It's loading.
Yes, Una, that's with us now.
Great. That's great. Thanks very much. So my name's Una Kennedy. I'm a GP in Phibsborough in Dublin part of the time, and the other part of the time I work as the GP advisor to the National Cancer Control Programme. And I'm going to begin straight away by contradicting myself. It's not so much cancer prevention and early diagnosis we're talking about. It's really, my slides aren't moving.
Una, if you want to come down to the very bottom left-hand corner and just click, yeah, there you go. Una.
Great, thank you.
No problem.
Great, yeah, so it's really cancer risk reduction and early diagnosis. And the reason for that is that you can't prevent every cancer. And you will come across people who say, well, look, I haven't smoked, I haven't drank, I do everything right, and I still get cancer. And look, what's happening? What's going on? And that can happen. The best you can do is try to reduce your risk of cancer if at all possible. And if that's not possible, try to make sure that you pick up cancer early if you have it. It always seems impossible to beat cancer, but as Nelson Mandela says, it seemed impossible until it's done. Hopefully one of the days we will do it. This is really acting up. Okay, just very briefly, what is the National Cancer Control Programme? So this is a directorate of the HSE. It was established in 2007 following the second National Cancer Strategy in 2006. And the aim of it is just to manage cancer care throughout Ireland. And its broad aims are to set up a comprehensive cancer control programme for the entire country, to adopt a whole population broad-based approach to deal with cancer in a planned way, to make sure that high quality cancer care is consistently available to all patients in the country, and to constantly monitor and improve the quality of cancer care. And the idea is that really, no matter where you are in the country, you should get the same standard of care everywhere in Ireland, and that standard of care should be the best that's available to you. So it shouldn't be the case that there's better care available in Cork than in Galway, or in Galway than in Dublin. It should be the standardised care across the country, and everybody should get the same standard. So I'll start a bit by talking about the cancer epidemiology in Ireland, the actual numbers for cancer in Ireland, what it is now and what it looks like it's going to be in the next few decades. So this is how it looks now. This is cancer today. At the moment, we have 24,000 new cases of invasive cancer every year in Ireland. That excludes non-melanoma skin cancer. Now, most cancer registries exclude non-melanoma skin cancer, so it's legitimate to do that. So it's 24,000 new cases of invasive cancer every year. That equates to 9,000 people or thereabouts dying from cancer every year, which amounts to one person every hour, every day in this country dying of cancer. We know that 1 in 2 people in Ireland will get cancer at some time in their lifetime in this country, and that's 1 in 2 of us on this call will get cancer at some point. And we know now that cancer is our #1 cause of mortality. It used to be cardiovascular disease, but in recent years it has taken over from cardiovascular disease. I'm not sure you can see it at the end, but a bright spark there at the end of all of this is that we now have over 200,000 cancer survivors in Ireland. So for the first time ever, more than 200,000 people in this country are living with a diagnosis of cancer. And that's actually really wonderful news. Some of it is down to the fact that more people are getting cancer, but some of it is genuinely down to the fact that there is better treatment and better survival rates from cancer. This is what the future looks like. So if you think the present looks a bit grim, unfortunately, the future looks a little bit more grim. Now, the National Cancer Registry had a go at predicting the cancer numbers in the coming decades in Ireland. Now, we all know you can't predict the future, but they had a shot at it anyway. And they reckon that between 2015 and 2045, the number of cancer cases in this country will double or thereabouts. And again, that's a very frightening thought, but actually it's not as bad as you might think. The fact is that the population is getting bigger. So if there are more people there to get cancer. So that's, in some respects, it's a good thing. There are more people around. We also know that our life expectancy is increasing. So Ireland now has the highest life expectancy in Europe, which is a good thing. But as you get older, your risk of cancer increases. So as our life expectancy increases in this country, the chances of people getting cancer will increase as well over the next few decades. And there's a very famous quote from Dr. Christopher Wilde there. He's a former director of the International Association for Research on Cancer. And he said, we cannot treat our way out of the cancer problem. Now, he doesn't mean that we can't treat cancer or we won't treat cancer. What he's actually saying there is, that's not the answer. The answer is to prevent cancer where you can. And if you can't prevent it, get in as quickly as you can and find it as early as you can when it's amenable to treatment and amenable to cure. And with the numbers going the way they are, really prevention and early diagnosis, they're going to be key to managing this. Now, this is a very complicated chart from the National Cancer Registry, and it just outlines the common cancers that we all need to look out for. So there are over 200 cancers that can happen in humans, and that just, it's just an overwhelming number of possibilities. But this graph, if I can draw your attention over to the grey chart on the extreme right of my screen, the grey chart, and there are 22 cancers listed there. Those 22 cancers account for about 90% of all the cancers we will see in this country. So we've gone from 200 cancers down to 22. And if you look at the bottom of that graph, you can see that the top 5 cancers, prostate, breast, colorectal, that's bowel cancer, lung, and melanoma of the skin, they make up a huge chunk there at the bottom. And in fact, those 4 cancers in men, 4 in women, 5 altogether, they make up almost 60% of all the cancers that we'll see in this country. So they make up more than half. Just those top 4 in men, top 4 in women, they'll make up the majority of what we'll see. And that makes it much easier to think about, I think, and to plan for. And this is what it looks like. This is what it looks like in males in Ireland. So those are the top 4 in males: prostate, lung, melanoma, skin cancer, and colorectal or bowel cancer. And those 4 will make up about 60% of all the cancers we'll see. The big one, of course, is prostate cancer. That makes up about 1 in 3 of all the cancers we'll see in men in Ireland. And it's really a remarkably similar picture for females in Ireland. You can see if you just substitute the word breast for prostate, it's almost identical. It's breast, lung, colorectal or bowel, and melanoma skin cancer. And they'll make up about 60% of all the cancers we'll see in females. And just like prostate in men, breast cancer in women makes up about 1 in 3 cancers in women in Ireland. Now, why are we going to talk about, why is prevention such a big deal? Why do we talk about prevention, or as I should say, risk reduction? And this is really why. about 30 to 40% of cancers, they reckon, are preventable. That's from the World Health Organization. So when we're starting to get a little flutter of panic about the number of cancer cases doubling over the next few decades, we need to remember that up to 40% can actually be prevented through risk reduction measures. That's lifestyle changes. And that picture on the right is a little tongue-in-cheek. It sometimes feels easier to take a pill or to perform surgery than to change your lifestyle. But really, that's where it's at in terms of cancer risk reduction. It really is about lifestyle changes. And again, this chart on the left of the screen, this is from the National Cancer Registry as well, and it lists our risk factors for cancer and how many cancer cases are caused by these risk factors every year in Ireland. The big one, not surprisingly, is smoking. And the National Cancer Registry reckon that 13% of all cancers in this country are caused by smoking. And that's 2,779 cancers in a year caused by smoking alone. And, you know, when you talk about getting on top of our cancer problem and will we ever fix cancer, will we ever stop cancer? I mean, there's your answer. It will stop a fair amount of it if we could all stop smoking. It's really important. Overweight and obesity, I think people forget, but it is related to cancer. They reckon it causes about 1,000 cancers every year in this country. And then infection, which I think people mightn't think of. You're talking about hepatitis B there for liver cancer, and HPV, human papillomavirus, which will cause cervical cancer and some head and neck cancers. And of course, don't forget HIV, that can be related to certain cancers as well. But again, the good news in terms of prevention, we can prevent some of these with vaccines. Alcohol intake, we need to have a think about our alcohol intake in this country, 500 cancers every year. And then sunbed and sunbed use. That's a single episode of sunbed and sunburn use, mind you. And that's quite a significant number of cancers for just a single episode of sunbed and sunburn use. So I'll deal with risk factors kind of piecemeal as we go through it, because it's very difficult to go through them all one by one, and you kind of, you know, very hard to keep your attention up, I think. So I'll just address them as we go through the different tumor types. And I just put in infections here, reducing your risk of cancer by preventing infections. As we said on the previous slide, about 766 cancers per year caused by infections. We can prevent some of them. We can prevent hepatitis B with our childhood immunization programs. The babies get the Hep B vaccine at 2, 4, and 6 months. And then the human papillomavirus for cervical cancer. The human papillomavirus vaccine is really, really exciting, the HPV vaccine. There's really good evidence that it's highly effective. So these are two recent reports from England and Sweden. 2021 in England, they found a substantial reduction in cervical cancer and in severe cervical abnormalities in young women since the HPV vaccine was introduced, especially the youngsters who got it at the age of 12 to 13. And this is what they say in that paper. The HPV immunization program has successfully almost eliminated cervical cancer in women born since September the 1st, 1995. It's incredibly exciting. It's incredibly exciting to think that you might actually be able to eliminate a cancer through a vaccine. They found similar results in Sweden. Swedish girls and women aged 10 to 30 years old who'd been vaccinated with Gardasil, that's the HPV vaccine. It resulted in a reduction in the risk of invasive cancer. So in Ireland, we give Gardasil 9, and that protects you about 9 out of every 10 cervical cancers. So that combined with screening, they reckon Ireland is going to eliminate cervical cancer. It's really very exciting. Now, early diagnosis. Why are we bothered about early diagnosis? And this is why. Now, this kind of fiddly screen here, this fiddly chart, there's data from the National Cancer Registry. And what I've tried to do is show the survival if you're diagnosed at stage 1 versus your survival if you're diagnosed at stage 4 of cancer. So I took those 4 common ones that we mentioned earlier: melanoma, skin cancer, prostate, bowel cancer, breast and lung. They make up 60% of all the cancers we'll see in this country. And I've just compared the survival if you're diagnosed stage 1 of those compared to if you're diagnosed at stage 4, which is late stage. And you can see straight away, first thing I think you can see is that the survival at stage 1 is actually very good. And we sometimes forget this in Ireland. We just think if it's cancer, it's the end of the world. the actual survival at stage 1 for most cancers is actually really good. You can see melanoma there, 99% survival. Prostate, bowel, breast, 97%. Admittedly, lung, the survival isn't as good, but still it's 51%. The survival drops quite a bit for all of them if you're diagnosed at stage 4, however, if you're diagnosed late stage. So it makes perfect sense, I think, to aim for picking people up as quickly and as early as we can. And it's really important to get that message out there to people. If you have symptoms that you're worried about, if you think it might be something, get in as quickly as possible and get checked out. And the outlook is so much better if you do. So I'm going to go down through the top 5 cancers now and go through risk factors, signs, symptoms, how you might try and prevent them or at least reduce your risk of getting them. So we'll kick off with lung cancer. Kicking off with lung cancer because lung is Ireland's #1 cancer killer. It's not our commonest cancer, but it's our biggest killer when it comes to cancer. So who gets lung cancer? Well, the median age at diagnosis is 70 to 74. It really is a disease of older people. So half people are diagnosed before that age, half are over that age. But almost all cases are in people over the age of 50. Not all of them, but almost all of them. The median age of death, unfortunately, is also 70 to 74, which does indicate how serious lung cancer is, that the survival just isn't great for lung cancer. Go back. Who's at risk? Well, older people, as we just said. So 97% of cases are in people over the age of 50 years. Who's at risk? Your smokers. Smokers, ex-smokers, passive smokers. You get various numbers here, but up to 80% of lung cancers are caused by smoking. So if you talk about, can we ever sort out lung cancer? Will there ever be a vaccine for lung cancer? I just think, well, there it is. There's your vaccine. Quit smoking. That will cut lung cancer by about 80%. It's strongly associated with deprivation. The numbers in men are the same as the numbers in women, and it's important to remember that we often think of lung cancer as a male disease, and it's really not anymore, that female cases are catching up with male cases. And it's more common in people who have COPD, which is smoker's lung disease, as you might expect. So that's the type of person who's at risk. 1 in 2 people who smoke will die as a result of smoking. It's something that we really need to get on top of. We know, as I said a minute ago, it's thought to cause 80% of all the lung cancers in this country. That amounts to 2,779 cancers in Ireland, 13% of all cancers. So if everybody stopped smoking, we could drop our cancer rates by 13% overnight, and that would be a wonderful thing. Apart from lung, it causes 15 cancers altogether: the nose, sinuses, the mouth, the upper throat, the larynx, the esophagus, as you'd expect, as that smoke is being inhaled down into the lungs. It also affects your esophagus, liver, stomach, kidney, pancreas, bowel, ovary, bladder, causes cancer of the cervix, leukemia. There's very few things or very few places where it doesn't harm you. And they reckon tobacco contains up to 69 different carcinogens. So how can you help people quit? I mean, there's loads of resources out there, as there should be, really. There's quit.ie, and there's the website, and there's the helpline, and there's lots of support there that you can use yourselves, indeed, or direct people if need be. There's national guidelines now on quitting smoking, and they have the 3 A's, where it's ask, advise, and act. So ask means asking people if they smoke. How much do you smoke? Would you like to quit? Do you want to quit? Can I help you to quit? And then advise is saying, look, really you should quit, and here's how you can, and there's things you can do. And then act, be it that you refer them to quit, be it that you refer them to a smoking cessation officer, or in my case, I can prescribe them stuff to help them quit. Act, do something to help people quit. The aim in Ireland is to reduce the prevalence of smoking to 5% by 2025. But at the moment, unfortunately, 18% of the population smoke, 14% daily, and another 4% just occasionally. The signs and symptoms of lung cancer, I took this directly from our website. This is available on our website if anybody wants to have a look at it. You can also get a copy of this poster from healthpromotion.ie. So if it's something you want to give out or want to use, you can get a hard copy of it. The big signs and symptoms of lung cancer are the cough and the breathlessness. So be it a new cough in someone who doesn't cough, that's going on for more than 3 weeks, or a cough that has changed, so somebody who's always coughing and there's a change in their cough, or breathlessness more than is normal for people. And I know that at the moment we're coming into the clinical winter, and we're getting to that point of the year where everybody seems to be coughing and spluttering, and it's very hard to spot the cough that could be a lung cancer cough from every other cough. But unfortunately, that's what we have to work with. But watch out for your at-risk groups. So if you have these symptoms in the older person, the smoker, the deprived person, then maybe you'd be a bit more concerned about those symptoms. Coughing up blood is something to watch out for. Unexplained chest pain. So if you imagine a tumor pressing on something in the center of the chest. Chest infections that keep coming back. Loss of appetite, feeling very tired, or weight loss that you can't explain. Weight loss is really a hard sign that shouldn't happen. Just a word about hemoptysis, and hemoptysis is just the word for coughing up blood. I think it's Latin, I'm not really sure. But it's one that everyone knows about, and it's one that everybody watches out for. It's like, oh, if I coughed up blood now, I get that sorted. But unfortunately, hemoptysis, coughing up blood, it's not a common presenting symptom. It's not common. It only ever occurs in about 20% of lung cancers. It only happens at all in about 1 in 5 lung cancers. And as a presenting symptom, that's as a first symptom, it only happens in about 5% of lung cancer cases. So you can't be waiting for someone to cough up blood. I mean, obviously, if they do, that needs to get checked out, but you can't be waiting for that. The cough and the breathlessness, the unexplained weight loss, the fatigue, they're the most likely presenting signs and symptoms. Now, what happens next? And this is important, because when you say any of this to people, they go, oh, sure, look, I never get an appointment. Oh, sure, they'll never see me. And there's no point going to see a doctor. Sure, goodness knows when I'll get my x-ray, you know. But in actual fact, that's not true. Ireland has 8 cancer centres around the country. There's 4 in Dublin, James's, Mater, Vincent's and Beaumont. There's 4 outside of Dublin, Cork, Galway, Limerick and Waterford. And you can see at the top here, lung. And what that means is there's a rapid access clinic for suspected lung cancer in each of those 8 centres. And I mean, I use these and I refer people to these centres. And if somebody is referred into the rapid access lung clinic, if there's genuinely a suspicion that they might have lung cancer, if there's a worry for it, they will be seen within 2 weeks. Now, maybe the odd time they'll fall outside that line, but generally speaking, they will get seen within 2 weeks. It does happen. So it's not the case that you'll be stuck on a waiting list forever. You will get seen quickly. So moving on to prostate cancer then. Prostate cancer, the commonest cancer in men in Ireland, and it's actually our commonest cancer overall in this country. So who gets prostate cancer? So it's commoner in older men. I think everybody would expect that. And the median age at diagnosis, so half of people are diagnosed before the age of 65 to 69, and the other half are diagnosed over that age. But the vast majority of people are diagnosed over the age of 50. And you see this again and again with cancer. It's more common in people who are older. Now, we all know people who got it when they're younger, but it's much more common disease in older people. It's not as big a killer as lung cancer. The median age at death is 80 to 84. So people tend to survive for quite some time with prostate cancer. This is the cancer map for prostate cancer in Ireland. And you can see this dark green bit over here in the west, that there's slightly higher numbers of prostate cancer there. I think that's just a function of the age profile there in that part of the country. So your risk factors, who's at risk of prostate cancer? Again, we keep seeing this, older age is the biggest risk factor for prostate cancer. Most cases occur in older men. Your ethnicity matters here. It's more common in Black African men than in white men, and it's least common in men of Asian ethnicity. Your family history, your genetics are important, so it's more common in men with a first-degree relative with prostate cancer. A first-degree relative is a father, a brother, or a son. So if you have a father, a brother, or a son with prostate cancer, your risk is that bit higher. It's more common in men with certain genetic mutations. So the BRCA1, they're called BRCA1, or the BRCA2 genetics, or some syndromes such as Lynch syndrome. You needn't worry too much about the BRCAs. It's more common in women with breast cancer, and people are more and more likely to know if they have it now. Unfortunately, of course, when it comes to reducing your risk, there's not a lot you can change here. You can't change your age or your ethnicity or your family history. So the symptoms, the signs and symptoms of prostate cancer. Well, this is an interesting one. It's very often in the early stage, prostate cancer doesn't cause too many symptoms. And this is how we imagine it might look. So if you have this big red balloon there, that's the bladder. This little tube here taking urine from the bladder to the outside world, that's the urethra. And you imagine this skin-colored or peach-colored area here, that's what the prostate is. And this little blue area is what you might imagine a tumor, prostate cancer, to look like. And as it's sitting there in the prostate gland, it isn't going to cause you any symptoms at that point, at the very early stages. Now, on this slide, you can imagine that that same tumor has got bigger. And now that same tumor is just pressing on the urethra, that tube that leads urine from the bladder to the outside world. It's pressing on that a little bit. And it's almost like if you're watering the garden and you step on a hose pipe and the water flow reduces, it has that sort of effect on the flow of urine coming out of the bladder. So that results in men having what we call LUTS, lower urinary tract symptoms. So there may be frequency, so you're passing urine more often. There may be nocturia, where you're getting up at night to pass urine more often. You may have difficulty passing urine, and that includes having a weaker flow of urine. You feel you're not able to empty the bladder completely. You feel like you're straining, you're trying to empty the bladder. Or you might have urgency, so you need to pass urine right away. You can't hang on. Now, most of those signs and symptoms are caused by benign growth of the prostate. Most of the time, in most men, those symptoms are not cancer. So don't anybody panic. They're caused by benign changes in the prostate. But they can be a sign of cancer, but most of the time they're not. However, if you're passing blood in the urine or in the semen, that's not a benign finding, and that does need to get checked out. Now, prostate cancer screening, I've left this slide blank because, as you probably all know, that there is no prostate cancer screening program in Ireland at the moment. And it's a question that comes up a lot from men, you know, that females have breast cancer screening and they have cervical cancer screening. So why is there no prostate cancer screening? And the reason is that nobody has ever managed to demonstrate for sure that it actually works, or nobody has managed to come up with a screening program that works. And I'd use the word yet there, yet. It may well be that a prostate cancer screening program will happen at some stage, that people will figure out how to do it and how to do it so that it actually works. But that's the reason there isn't one. It's not that nobody cares about male cancers, not at all. Now, again, just like with the lung cancer people, what happens if you're worried that somebody might have prostate cancer? And it's back to just addressing that whole thing of, oh, I'd never get seen at, or I'd never get an appointment, and what's the point in going to get it checked out? Well, we have our 8 cancer clinic centres. So 4 in Dublin, 4 outside Dublin, and there is a rapid access clinic for prostate cancer in each of those centres. So again, if there's a genuine concern that somebody has signs or symptoms or a reason to believe they may have prostate cancer, I can send off a referral electronically. It'll be in the centre straight away, and they will be sent an appointment within a couple of weeks. And those centres are working, it is happening. The next of the top 5 would be colorectal cancer. That's bowel cancer, as more commonly known. Now, in terms of bowel cancer screening, you know, we just said that there isn't a screening program for male cancers, but there actually is. There's bowel screening, and that screens for bowel cancer in men and women. And you can see the website there, bowelscreen.ie. I've crossed this out at the top here. It's available to men and women aged 60 to 69 years. That's actually going to change very soon. There are plans to reduce that to 59, which is really great news. So there's a whole bunch of people aged 59 who can now be screened for bowel cancer who couldn't have been screened up to now. So it's really good news. Bowel screen is really good at picking up bowel cancer. 60% of bowel cancers picked up by bowel screen are picked up at stage 1 and 2. but just 40% overall in Ireland altogether are picked up at stage 1 and 2. So actually, bowel screen is really good at picking up bowel cancer early. Unfortunately, the uptake for bowel screen is about 40%, which means that 4 out of every 10 people who could participate in bowel screen are participating. 6 out of 10 people are not, and that's a real shame. So I would urge you, if you are within the age bracket 59 to 69, or if you know somebody who's in that age bracket, please, please, please register them for bowel screen. It's a great screening program. It's not too difficult either. This little kit that you see here on the side of the screen, that's what happened. You ring up, you register, or you go online and you register, and they send you out the kit. And the kit is this little tube here with the dipper in it. And you unwrap it all, take out the dipper, and you dip that into the bowel motion, into the stool, package it back up again and send it back to bowel screen. And if there's blood in it, they will call you for a colonoscopy. That's the camera. And they send you the gloves and everything. They send you the means to repackage it up. You post it back for free. I mean, you can almost do it without leaving your own home. You know, it's a really good screening program. And you know what we were saying about bowel screen being really good at picking people up at stage 1 and 2? I just wanted to recap. This is the survival for bowel cancer at stage 1. It's 97%. If you're picked up at stage 4, it's 10%. So, I mean, if you have bowel screen available to you, really, you should be participating in it. The difference it can make to your survival is absolutely huge. Driving home that message again, bowelscreen.ie, and there's your free phone number, 1-800 45 45 55 to register. Now, the risk factors for bowel cancer, family history. And here we are again, tobacco smoking. You can't do anything about your family history, but you can do something about tobacco smoking. Alcohol, and again, you can do something about your alcohol intake. Greater body fatness, so weight. And weight is not easy to change and not easy to fix, but we all have to try to maintain a healthy body weight as much as we can. Your diet, red and processed meat, so those would be your salamis, your rashers, sausages, they're associated with an increased risk of bowel cancer. And HPV infection, it's really associated with anal cancer. But there's a lot there that we can do, and a lot that you can take into your own hands to reduce your risk of bowel cancer. So there is good news there. So what do you do? I mean, now this applies to an awful lot of cancers. I just put it in conjunction with bowel cancer. So the healthy balanced diet, not only will that help you keep your weight down, but it will also help you reduce your cancer risk in and of itself. So cut out the red and processed meat, plenty of fruit and vegetables, plenty of whole grains. Don't fret too much about individual foods, but just overall try and keep it healthy. Work on improving the amount of plants that you eat. So whole grains, fruits, vegetables, pulses. 5 portions a day of vegetables and fruit if you can. And that's non-starchy fruits. So unfortunately, vegetables and fruits. So unfortunately, potatoes don't count. Now they're good foods, potatoes, but they're not non-starchy vegetables. Try to limit foods that are high in fat and sugar and salt. I guess they're not good for you anyway, but they're going to be linked to making you more likely to be overweight or obese. Avoid processed meat and limit red meat because they have been linked to bowel cancer. Try and get some physical activity. So physical activity in and of itself will reduce your risk of bowel cancer, but physical activity will possibly reduce your weight, and reducing your weight will reduce your risk of cancer. So what we're aiming for is 150 minutes. I think if you can keep that number in your head, 150 minutes. So it's 75 to 150 of vigorous activity, or 150 to 300 of moderate activity. So if you have that figure of 150 minutes in your head, that's an easy one to remember, and that's how much activity we all need to be doing every week. Again, this poster is on our website, and the hard copy is available from healthpromotion.ie. You can get a copy of it delivered to you. So what are you looking out for colorectal or bowel cancer in terms of signs and symptoms? So a change in the bowel habit, such as diarrhea, constipation, going more often for more than 6 weeks, feeling like you need to pass a bowel motion even though your bowel is empty, or you know it's empty, you just have passed a bowel motion, feeling like you haven't emptied it properly, or you need to go again. unexplained bleeding, and bleeding keeps cropping up. Anywhere you have unexplained bleeding, probably you should get it checked. Unexplained tummy pain or pain in your back passage, an unexplained lump or swelling in your tummy, unexplained weight loss, and again, that keeps cropping up, unexplained weight loss or weight loss you hadn't been trying to achieve, feeling very tired all the time, and then breathlessness more than is normal for you. Some people, especially people with smoker's lung disease, might be breathless anyway, but more than is usual for you. Now, what happens if you have those signs and symptoms and if you get referred in? Well, if you come in to me with signs and symptoms that are suggestive of bowel cancer, or come into any GP, you can get referred electronically straight to colonoscopy. That's the camera into the back passage to have a look at a bowel. So we have direct access there. And you didn't bother too much trying to remember all these names of hospitals, obviously, but it just shows you the list of places where there is direct access to colonoscopy, and that list is growing all the time. Now, melanoma skin cancer, one of our commonest cancers. Melanoma skin cancer hits possibly maybe a slightly younger group. The median age at diagnosis is 60 to 64. Median age at death is 70 to 74. But a reasonable enough proportion, about a quarter of all skin cancers will be in people who are under the age of 50. So it does affect young people more than some of the other cancers. This is the melanoma map of Ireland. So the paler places are where there's less cancer, less melanoma cancer, and the darker places are where there's more melanoma skin cancer. And you can see that it's darker down at the sunny southeast where they get a bit of sun and they're exposed to the sunlight a bit more. And they're up at the north Donegal where those poor souls never get sunlight. The numbers of skin cancer are a little bit lower up there. The risk factors, older age. I mean, I know a quarter of them happen in people under the age of 50, but again, older age is a risk factor for melanoma skin cancer. Your family history, again, if you have a first-degree relative who was diagnosed with melanoma at a young age, so first degree being a parent, sibling, or a child. And it's a really important thing is exposure to the sun. The ultraviolet light that's in sunlight is a huge risk factor for skin cancer. 90% of skin cancers are caused by exposure to ultraviolet light, that's sunlight and sunbeds. And again, when we wonder, will we ever get a vaccine for skin cancer? Well, again, there it is. There's your vaccine for skin cancer. Keep out of the sun. Now, they've said here, this is this slide, they've said they reckon 414 cases every year due to a single episode of sunburn and sunbed use. But we know that actually about 90% of cases are caused by sun exposure. So who's at risk? And this is how to imagine our skin. This is a skin scale that was created by a guy called Fitzpatrick working in New York some decades ago. He was actually of Irish extraction. And he just decided that skin could be broken down into 6 types. Type 1 being the very fairest skin and type 6 being the very darkest skin. And not only was it broken down by color, but it's also broken down by how it responds to the sun. So if you look at there, type 1 would be your very pale white skin, blue-green eyes, or blonde or red hair. And your typical type 1, I think, would be Prince Harry. He's got that pale skin, red hair, blue eyes. And this is somebody who will always burn in the sun. They just can't take the sun at all. They'll always burn, they don't tan. Type 2, you have fair skin and blue eyes. You'll burn very easily and tan poorly, but you might not always burn. Type 3, darker white skin, and you will tan up after you burn initially. Type 4, light brown skin, so you maybe burns minimally and will tan easily. You may be talking about, say, Italians, Spanish, they'll burn a bit, but they'll tan mostly. Brown skin is type 5, rarely burn, but will tan up very darkly. I imagine Indian or Filipino nurses probably are type 5s. Type 6, dark brown or black skin, which will never burn and will always tan darkly. And I imagine the Williams sisters, Venus and Serena Williams, I always imagine are probably type 6s. So they'll never burn, but they will tan up. Everybody's susceptible to skin cancer, but types 1 and 2 are particularly susceptible to skin damage from the sun. And the majority of people in Ireland are type 1 or 2. The majority of people in Ireland have pale skin, fair skin, light-coloured eyes. The majority of us will tan badly and will burn easily, and we're very vulnerable to the sun. So what do you do? And this is really important for children especially. We've got to keep those babies out of the sun. So slip, slap, slop, seek, and slide. So slip on clothing that covers up your skin, and unfortunately that means long sleeves, wide brims, hats that cover your ears and the back of your neck. Slop on sunscreen, at least factor 50 for children and at least factor 30 for grown-ups. Slap on that wide brim hat, and that's the one that covers the ears, covers your face, and covers the back of your neck, especially for men with short hair. Seek shade, especially between 11 and 3 in the afternoon. And really what that is, just get out of the sun. Don't be out in the sun. Just stay in the shade if you can. And then slide on sunglasses to protect your eyes. Now, I put this up. This is from the National Cancer Registry. They did a report on children and adolescents and young adults recently, and they looked at cancer numbers in that age group, children, adolescents, and young adults. And I thought I'd put this up because it's just interesting, and it shows you the difference that you can have when you encourage people to get out of the sun, or indeed encourage, I think, people to take any measure that will reduce their risk. This is the incidence of malignant melanoma in young people aged 16 to 24 in Ireland. Now, it's from 1996 up to 2020. So you can see here the blue is the boys, the males aged 16 to 24. And between 1996 and 2020, like, it's great, there's a steady decline, it's very good news. But there you see the girls from 1996 to about 2014, we can see it's actually rising. The number of cases of skin cancer in girls in that age group, 16 to 24, was rising. And then we see a sudden collapse. It just suddenly drops off. And what happened there in 2014? It was in 2014 that the government introduced a ban on sunbed use in youngsters under the age of 18. They banned it. Now, you can't say for certain that's the reason for that fall off in skin cancer, but it's certainly quite a coincidence. And it certainly would demonstrate to me that we just cannot put kids on sunbeds. For confirmations, communions, debs, they just shouldn't be anywhere near sunbeds. But I hope it would also demonstrate that cancer prevention advice and cancer prevention measures can work. The signs and symptoms that you're looking out for melanoma. So we have the ABCDE system. And that's for how you look at a mole. So A is for asymmetry. The mole is just not an even shape. Most of our moles are circular or are symmetrical. Asymmetry is a significant sign. B is the border. So if you have an irregular border on the mole, again, most moles are nice and circular, but if it's an irregular shaped mole, maybe get it checked. C stands for your two different colors in the lesion. D looks at your diameter. So if the mole is more than 6 millimeters, maybe get it checked. And 6 millimeters is about the diameter of a pencil. E is for evolution of the lesion. So the mole is changing. So it's getting bigger or lumpier or blacker, or it's bleeding, or there are little moles popping up around it. If things like that are happening, maybe get it checked. A, B, C, D, E. And then one final one is the ugly duckling sign. So if you've one mole that is different to all the other moles, that could be significant. Now, what happens next? And we're back to this idea of, oh, I never get seen, they'd never send me an appointment. Well, we have pigmented lesion clinics around the country in these hospitals. There's a list of them there. And again, your GP can send an electronic referral to the pigmented lesion clinic. Generally speaking, people who are found to have melanoma skin cancer will get their diagnosis in about 4 to 6 weeks. So actually it works well and it works quickly. So there's no reason not to get referred in quickly if you have a mole that you're worried about. And really, people should be checking their skin and checking their moles all the time. We all just should. Every morning after the shower, just do a scan of your skin, see what it looks like, and if there's a funny looking mole, get it checked out. And last up is breast cancer, which is the commonest cancer in women in Ireland. So like the others, here's the age profile at diagnosis. About half of all cases are under the age of 55 to 59. Half of all cases are over the age of 55 to 59. And then there's a 10-year gap from there to the median age group at death. So half of all cases of death will occur before 65 to 69, and half will occur after that age. And again, not unlike skin cancer, a sizable enough proportion of breast cancers occur in young women, women under the age of 50. So about a quarter of them will occur in women under the age of 50. Breast cancer screening, I'm sure everybody will know about BreastCheck, breastcheck.ie. It's available to all women aged 50 to 69. They get screened with a mammogram every 2 years. If you're in that age group and you haven't been called, it's worth giving them a ring or going online. Strangely enough, the uptake for BreastCheck is about 75 to 80%, which means that there's a significant number of women who aren't availing of BreastCheck, and that's hard to understand, but I would strongly urge everyone to participate, and if you know anyone who's not participating, certainly encourage them to. We know that BreastCheck picks up about a third of all the breast cancers that are diagnosed in this country. It's pretty good at picking up breast cancer, and it's good at picking up breast cancer early. Your risk factors. What are your risk factors for breast cancer? There are some things you can't change. They're non-modifiable risk factors. You can't change them, but at least you should know about them. And if you know about them, you just might be alert to the risk of breast cancer. First thing of age, again, it keeps cropping up. The risk of breast cancer and cancer in general increases as we age, and we have that aging population. We're all living longer. Your family history, your risk is higher if you have one or more first-degree relative with a history of breast cancer. So if you have a parent, a sibling, or a child with breast cancer, that puts you at a higher risk. If you happen to know you have these genes, BRCA1 and BRCA2, then you have a slightly higher risk again of developing breast cancer by the age of 70. If you have a history of breast cancer, so if you've already had it, that increases your chances of getting it in the other breast. Your reproductive history, so if you've never had children or if you've had children later in life, that can increase your risk. Exposure to ionizing radiation, and really what they're getting at there is that if you've had a tumor somewhere in the lung or in the chest that has required radiation therapy, that can increase your risk of breast cancer later. Things you can change. So there are modifiable risk factors. There are things you can do to reduce your risk. So things that increase your risk of breast cancer, being overweight or obese. And it's not easy to lose weight, but everybody just has to make that effort to get their weight down or try and maintain it at least and not try to increase anymore, even if you can't quite get it down. And alcohol accounts for about 1 in 13 cases of breast cancer. Now, you can't pick out somebody and say to that somebody, well, your breast cancer was caused by alcohol. It's just impossible to do that. But the people who do the number crunching can say, based on the amount we drink and based on the amount of cancers we get, we know that about 1 in 13 breast cancers are caused by alcohol. So it's certainly worth taking a look at your alcohol consumption and seeing, can you cut it down? Some medications, HRT and combined oral contraceptive pill, I've always saying these things, I'm not going to take questions about HRT and the pill. It's just so complicated and so individual. You need to talk to your GP in person about those. Things that decrease your breast cancer risk, breastfeeding will reduce your risk of breast cancer. Physical activity reduces your risk of breast cancer. It's good for you anyway, but it'll reduce your risk of breast cancer. And eating a healthy diet, fruit, vegetables, whole grain, that's associated with a lower risk of breast cancer. So there's a lot you can do to reduce your risk. Just to mention a couple of those risk factors in a little bit more detail. So obesity. The NCRI would say it causes about 1,000 cancers every year in Ireland. And we know that in Ireland, about 35% of people say that they're overweight, another 21% say they're obese. 15% of 5-year-olds were overweight and 5% are obese. And it's related to a whole bunch of cancers. You can see them there on the side of the screen: the mouth, pharynx, larynx, esophagus, the breast, liver, stomach, kidney, gallbladder, pancreas, bowel, ovary, cancer of the womb, and in some cases of advanced prostate cancer. So it's worth trying to work on your weight. It might reduce your risk. Alcohol, as I said, about 1 in 13 breast cancers in Ireland every year. There's about 3,500 breast cancers. So that tots up to a sizable enough number of cancers that could be due to alcohol. There's no safe amount of alcohol. So unfortunately, when it comes to cancer, the only safe level of alcohol is 0. The more you drink, the more that risk goes up. Now, as you can't pick someone out and say, well, we know that your cancer was caused by alcohol. You can't do that. But we just do know that no alcohol is safe when it comes to cancer. The Department of Health would say, whatever you do, at least for men, try not to consume any more than 17 standard drinks, and for women, no more than 11 standard drinks per week. But obviously, if you could aim for less than that, that would be great. Signs and symptoms of breast cancers. Everybody will know the first one, the changes to the breast or the axilla, be that a lump in the breast or a lump in the armpit. Be warned that the breast can extend up under the arm. Some breast tissue can get up there. So if you find a lump up there, it has to get checked. Changes to the nipple. So be it that there's a discharge, be it blood or watery fluid from the nipple, or sometimes if the appearance of the nipple has changed. So either it has been kind of dragged into the breast, or it's moved or twisted, or it's stuck in a position when that's not the way it's always been. And skin changes. So you can get redness of the skin, a tender area, puckering or dimpling of the skin, like the skin is tethered. If you imagine your clothes getting snagged on a nail, that sort of appearance. And nipple eczema, that's eczema around the nipple that doesn't respond to treatment. It's just worth saying there at the end that breast pain all on its own does not suggest breast cancer. So if you have breast pain and no other signs and symptoms, that's not a sign of breast cancer. But if you're worried, look, get it checked. What happens if you have breast cancer? It's just like lung, just like prostate. We have 8 cancer centres around the country, 4 in Dublin, 4 outside Dublin. There's a rapid access clinic in each of those. And breast is one that I would use a bit, being a female GP. I'd see a lot of females, and you send up the electronic referral and people do get seen within 2 weeks. It works really well if they're considered a high risk for cancer, if there's a worry for them. So in summary, just the big talking points, I think you just can't go down through every risk factors, but the big ones, the smoking, 80% of lung cancer is caused by smoking and a whole bunch of other cancers. The weight, 1,000 cancers a year caused by weight in Ireland. Try to eat a healthy diet, try to watch your weight and get the 150 minutes per week of exercise. The alcohol, there's no safe level. It causes multiple cancers, including 1 in 13 breast cancers. And then sun and ultraviolet light. Get out of the sun. It's causing 90% of our skin cancers in this country. But you can't get out, the slip, slap, slop, slide and seek. All of this and more is available on HSE Land. We did a module on cancer risk reduction. There's about 10 or 11, they're about 10 or 15 minutes each. You can dip in and out at your own pace. They're free. And there's a lot more information than I can go through here. And we also have a HSE Land module on early diagnosis of cancer. And there's 2 modules. They're about half an hour each. And they go into more detail, again, than I can go into here. And finally, on our website, there's a whole load of resources on our website, hse.ie/cancer. And all these posters that I put up, they're available on our website if you just want to read them, or they're available in hard copy from healthpromotion.ie. You can go into Health Promotion and they'll send you out a hard copy. And they're a lovely thing to have and a lovely thing to give out to people if you want to give some people something to look at and read about later. And that's me. Thank you very much.
Una, thank you so much. That was absolutely amazing presentation and fascinating insight into cancer. The thing that struck me most was the fact that we can say, that we can almost eliminate, the HPV cancer through a vaccine is just really fascinating.
It's so exciting, isn't it? Yeah, it's
really
so
exciting.
Yeah.
The other thing that I'd just like to say, because there was a huge focus on lung cancer, I'd just like to remind everybody in DNCC that we have a free stop smoking service that you can avail of. So that's either for yourself or for any of your patients or anybody that you know. If you'd like to avail of this, you can call 018976124 or email us on hwb.dncc@hse.ie if you'd like to avail of that service. And so we did get a couple of questions. If that's okay, we might kick off with those. This was quite an interesting one that came in before the webinar. This person is just asking, many people didn't present with concerns during the pandemic. Are we doing enough to reach those people now?
We're working on it all the time. God, are you ever doing enough? I think enough is a question. I think enough, you probably have to say no, because you never do enough. It's just, you cannot do enough. Are we doing something on it? Yes, we are. And we have a cancer prevention and early diagnosis function in the NCCP. And we've been working on this almost at the beginning of the pandemic. So yeah, there is work going on all the time. You might not always see it because it's sometimes targeted. So it tends to be targeted at risk groups, and it's targeted at specific cancers. But yeah, there's work going on all the time. But this is, I think, an endless job. I mean, we'll always be working on trying to encourage people to detect cancer early.
Yeah, absolutely. And just two questions came in about the hot topic of vaping. So the first one is there research yet completed on vaping and cancer risk?
Oh, don't get me started on vaping. I could be here all day. Right, vaping. Do you know what? I think there's things you need to know about vaping. Is there any research? I would say completed is the key word there. There's a real lag in getting research started and done and finished and out into the open. And while we're waiting for all that to go on, the tobacco companies are in there and they're promoting vaping while we're waiting to gather evidence. Here's what we do know, right? What about quitting cigarettes? Like, can vaping help you quit? And the answer is, it is probably not any better or worse than what we already have. Okay, so it's not any better than your patches, your nicotine, your Champix, your tablets, and your smoking cessation officers. It's no better than that. And I would say to you, why would you go for a product that is unregulated, unlicensed, goodness knows what's in it, and it's not available on a medical card either? Whereas on the other hand, we have stuff that is licensed and regulated and is safe. So it's probably the same as nicotine replacement for quitting, but I mean, you just wouldn't. Is vaping as bad as cigarettes? I mean, surely vaping isn't as bad as cigarettes. That's one thing you hear all the time. Now, there are very few things that we are legally allowed to do that are as bad as cigarettes. 1 in 2 people who smoke will die as a result of smoking. So I actually can't think of anything that's as dangerous as that we're legally allowed to do. Smoking puts 1,000 people in hospital every week in this country, and it kills 100 people every week in this country. So maybe vaping isn't as bad as cigarettes, but it's a pretty low bar. Now, in terms of quitting, I mean, you know, I Googled before we came on here, I Googled vaping flavors, and I found bubblegum, I found Rainbow Blast, I found cotton candy, and Love Hearts in terms of flavors. Those are not flavors that are aimed at getting a 50-year-old man off smoking. They're aimed at kids. And I would say to you, Love Hearts and cotton candy are probably aimed at little girls more than little boys. Maybe that's me gender stereotyping, but there you are. We know that, they are, aren't they? We know that 1 in 10 children in Ireland between 12 and 18 has vaped in the last month.
Mm-hmm.
We know that most of the vapes contain nicotine. We know that nicotine is addictive. We know that nicotine can have long-lasting damaging effects on the brain development. We know, because there is evidence for this, that children who've never smoked but who vape have at least double the chance of smoking in later life. We know that most of the vapes are controlled by tobacco companies. So, I mean, you know, yes, there is more evidence coming out all the time about vaping, but you really have to ask how much more evidence you would need.
Yeah, I mean, that's, it's a difficult one to answer in a short space of time as well. But I think that kind of sums it up really well. We might just finish on this last question, if that's okay. This is a lovely comment for you, Una, saying that a really lovely, straightforward and practical approach to risk reduction, early identification and positive steer on management. Best use of lunchtime in a long while. Thank you very much.
Thanks very much.
And on that, I'd just like to say thank you again for your fascinating webinar, and just to let everybody know that this webinar has been recorded and it will be available to those who registered, and it'll also be available on our national YouTube channel. And just before we head off today and everyone heads back to work, there's just a couple of things, if it's okay, to let you all know about. So tomorrow we do have a face-to-face event in St. Mary's. That's our Culture and Diversity Day. If you would like to register for this event, you can scan our QR code there. Also, our next webinar is next Wednesday, the 25th of October, and that's with our community dietitians, Adele McNamara and Elaine Guinan, and they're going to talking about weight. So if you'd like to sign up for any of the webinars, just scan our QR code. Also, I'd be extremely grateful if you could complete our survey on today's webinar, and if you do, you've got a strong chance of winning a lovely voucher. Yeah, so that's it. So thanks everybody, and thanks so much for attending, and have a great day.